I'm talking to Jay Wortman, who's a Canadian physician. So tell me, how did you become interested in low carbohydrate diets?
Well, as a physician, I was not a very good physician because I allowed myself to develop a preventable condition. I actually developed type 2 diabetes.
Oh no.
And I have a strong family history of it. And was actually had a florid case of it with all the symptoms and signs, and I guess I was in denial because I didn't realize it right away, and then eventually it dawned on me that I had all these symptoms, and so I tested myself and I found that I had very high blood sugar. And I, at the time, was doing administrative medicine, so I hadn't been doing clinical work for a while. So I wanted some time to look into diabetes and refresh myself on what the current treatments were and so on. And so I decided that I needed a little time to do that, so I decided I would stop eating carbohydrates because I wanted to minimize my hyperglycemia. And I knew nothing about low-carb diets, but quickly discovered that all my signs and symptoms of type 2 diabetes disappeared within a matter of days, and that I started losing weight at about 1 pound or about half a kilo a day.
That's fast.
For about, yes, and it continued for about a month. I lost about close to 15 kilos in a month on this diet, so I became very interested in what was going on, and so I started looking into it and reading and discovered some of the scientific literature, and it basically changed not only my health for the better, but it diverted me onto this path where I spend my entire time now looking at low carbohydrate diet, doing research, focusing on this particular issue. Yeah.
That's interesting. And it's been, what, 8 years?
I've been doing this diet for very low carb ketogenic diet for about 8.5 years now.
That's a long time.
And by doing that, I've maintained my weight loss. I've got normal metabolic markers. I take no medications.
So your blood sugar is still normal?
My blood
after
sugar is perfect.
8 years with no medication?
No medication. My last hemoglobin A1C was 5.1.
Right.
My CRP, my inflammatory markers, are very, very low. My CRP is less than 1.
Okay. So is it hard
Is it
for
hard
you?
to do?
Is it hard to do this?
You know, initially it was. I think there's some convincing evidence out there that there's an addiction issue here with carbohydrates, particularly sugar. So I think what my observation was initially, it felt like I was going through a drug withdrawal. My cravings for sugar and sweets and some carbohydrates was strong, but you quickly get over that, and it tapers off over time. And now, it's not hard at all to do it.
No. So what do you eat most
I
of
eat
the time?
lots of meat and fish and poultry and fowl. And
So do you miss anything?
there isn't really anything I miss because I figured out how to do things. Well, I missed chocolate initially,
Yeah.
but I figured out a recipe for low carbohydrate chocolate ice cream, which I
Right.
make myself, and that satisfies my craving for chocolate. So there are ways to manage this diet, and it certainly doesn't feel like I'm deprived.
Do you eat any bread,
No.
pasta,
No.
rice?
No bread,
none
no
at all?
pasta, no rice. No, not at all. No.
So how about your family?
My wife follows pretty much the same diet, and she's been doing it for as long. We have a son who was 2 years old when we started doing this. He had already developed a sweet tooth. He still eats some of the more complex carbohydrates. He'll eat bread and pasta and things like that, but he gets virtually no sugar in his diet. He eats whole fruit, but no fruit juices, no sugary drinks, no sugar. There's no sugar in our house. And he does very well, very well. My wife got pregnant 2 years ago, and she maintained a low-carb ketogenic diet throughout her pregnancy.
Wow.
She delivered a normal, healthy, thriving little baby who was breastfed while my wife stayed on a ketogenic diet, and who is now eating a low-carbohydrate, high-fat baby diet.
Yeah.
We prepare all the foods, lots of
such as?
Well, we make lots of vegetable purees with cream and butter and cheeses. She gets meat sauces, meat stews that are made for her palate. She eats meats and fish, and she loves olives and smoked salmon, and she's got a taste for wine. She likes wine.
Wine?
We don't give her wine, but she would if we would. She would drink the wine that we have at the table.
Yeah.
So, and it's really interesting with her. She started out at the 50th percentile for height and weight when she was born. She quickly zoomed up to the 95th percentile for height and the 75th percentile for weight. So she's tall and slender and growing like a weed. She's almost 20 months old now, and she's never had a fever, never had a rash, never
That's
been
really
ill
interesting.
at all.
Yeah.
She's just a sturdy, thriving...
Do you have any worries about pregnancy on a low-carb ketogenic diet and giving it to kids?
Not based on my experience personally with this in my family, and also my rationale for it is looking at it from the fetus perspective. What's different in a low-carb ketogenic gestation? Normal glucose levels, low normal insulin levels, no exposure to fructose, no big excursions on glucose or insulin, some ketones, physiological levels of ketones. There's nothing there that causes me any alarm in terms of the welfare of the fetus. And the result has been wonderful. We have a wonderful, thriving, healthy young child as a result of that.
That's interesting.
Yeah, so I have, I don't see any reason not to do
Do you
this.
see any difference between your kids and the neighbors' kids, so to speak?
Of course, my kids are much better behaved.
Of course, they're much better. But I mean, do you see anything that you kind of see that you connect to the diet?
We have in our household a very low, a very stable emotional environment. Our children are not having outbursts, they're not crying. Even the baby cries very little. They have stable emotional levels. My son, we never have big issues, no big discipline problems, no big emotional meltdowns. And they don't get sick. My son never gets ill. He doesn't miss school. He doesn't get the viruses that are going around. And if we do get the viruses, it's very mild. It's like a little bit of rhinorrhea and runny nose or whatever, but nobody gets terribly ill. So I think that's due to the diet.
That's fascinating. I know you did a study with the Aboriginal population in Canada for weight loss and diabetes. Could you tell a little bit about that?
Well, one of the things that struck me about this diet is that the area I work in, the First Nations people, the Indigenous people, had a diet, their traditional diet was very low in starch and sugar. And now they've got terrible problems with obesity and diabetes.
Yes.
So it occurred to me that if they ate a diet that resembled their traditional diet, maybe we could correct these problems. So we did a study where we went into a small community on a tiny little island, and we asked them to do this diet, which was their traditional foods plus market foods that were low in starch and sugar. So it's a low-carb ketogenic diet. And we recruited about 100 people into the study, and people did well based on their compliance. If they complied with the diet, they got all the metabolic improvements and they lost weight, and they did very well.
Okay, so how was the compliance?
The compliance was pretty good. We had some issues because working in this remote environment, it was hard to keep staff there to run the study, and we had a changeover in staff during the course of the study, and I think we lost some people, not because of the diet, but because the disruption of the staff changes and so on was a problem. But based on both our findings and our subjective observations, people did very well.
Do you remember any cases? Some
Yes.
people doing.
There were some dramatic cases.
Such as?
There was one old gentleman. He was in his 70s. He had been a carpenter in his life. He was very active, but now he had diabetes. He was overweight. He was medicated, sedentary. Didn't do anything. Watched TV all day. He lost over 50 pounds.
Right.
He got off all his medications, and he had so much energy. He went back to work as a carpenter in his 70s. And we had lots of wonderful stories like that. Yeah.
Fascinating.
So it was very good. Yeah.
So how can we make this more accepted?
How do we do that? I think we need more studies, more compelling studies. And I think we need to focus on the opinion leaders. I think we need to convince the big authorities like the Diabetes Associations and the Heart and Stroke Associations. We need to give them enough evidence that they can't ignore it. And that compels them.
Can we do that? Is it possible?
We're working on it. I work on it. Others here are working on it.
Well, thank you.
My pleasure.